Good evening and welcome to Vax Facts and FAQs. VFF is a virtual discussion on how to get healthy or how to stay healthy and get up-to-date information on flu and COVID-19 pandemic and vaccines. This month, we will be discussing pandemic updates, flu updates, updates on the triple-demic, and layers of protection or tools that are available to us to protect us from the flu, COVID, and other viral disease that are circulating. And then, of course, we'll end with FAQs. So first, beginning with our pandemic updates, different than the last time we showed our lovely community levels map, a large number of counties are experiencing high community levels for COVID-19. And we should expect to see this continue throughout the winter and holiday seasons because this is kind of what we saw last year and the year before. During this time of the year, there were increases of cases. And if you look over at Michigan, right over here, you'll see that we're one of the states that does not have, at this time, a high community level. In any of our actually a little county up in the Upper Peninsula, but here down in Wayne County and Southeast Michigan, we are experiencing low or medium community levels of COVID-19. And monitoring the community levels is a great way to gauge the best practices or what we should be implementing to protect ourselves based on the level of COVID circulating in our communities. So for Wayne County, or for, I think that it might be Monroe, who has medium community levels, it is recommended that you stay up to date with COVID-19 vaccines, get tested if you have symptoms, wear a mask if you have symptoms or a positive test or exposure to someone with COVID-19. And it's also recommended to wear a mask on public transportation. And these are all recommendations, but you may choose to wear a mask at any time as an additional precaution to protecting yourselves and others. And if you are high risk for severe illness, you may consider wearing a mask indoors in public and taking additional precautions. And like I said earlier, we're going to be talking about the different layers of protection that we can implement as we navigate this winter and holiday season. One tool that we want to discuss is that through the website covidtest.gov, each household is eligible again for free at-home COVID tests. This that I'm showing you is the landing page of the website. You just click on this big blue button and you are able to order your test. This was something that was available earlier on in the pandemic, but due to this rise in cases again, the Biden administration has kind of revamped this COVID testing program, which allows households to get those free COVID tests. Now, this is not the only way to get access to tests. You can still get tested at your pharmacy. You can get tested with your doctor, local health departments, and you can also purchase tests from places like CVS or Walgreens. But this is a way that you can have these in your home at your disposal for free. And this is especially important and especially relevant during the holiday seasons where we'll be traveling. You might be doing international travel. So it'll be great to have this with you. All right, so moving into our flu updates. So the flu has surged in the United States after Thanksgiving, and it's brought the most severe week yet this season and hit and the flu, unfortunately, is even early to some counties. So more than a third of flu hospitalization and deaths so far were reported in just the past week. and cases also jumped that much as well. All but 7 states are experiencing high or very high respiratory virus activity, according to the CDC. So there are some states, including Michigan, that have low or minimal activity. But that is not to say that you can't get vaccinated, which is the best protection against the flu, and that's not to say that you aren't going to get it. And so you should know what the next steps are if you do feel that you are getting sick. So if you're having flu-like symptoms, you may want to get tested for COVID, because there is some overlap. If you may think that you are exposed to COVID, but then you might want to go to the doctor if you rule out COVID, or if you're really feeling unwell, go to the doctor and they can rule out flu or any other respiratory virus. And for flu, there are antivirals available, and same for COVID. So again, you may want to reach out to your doctor. You may want to get tested to rule out COVID. But that is the update that flu is surging at the moment, along with COVID, which is why we have this term coined, the triple-demic. So the cold and flu season is off to an early start. Like I said, there is a concern for a triple-demic due to respiratory syncytial virus, or RSV, which is way easier to say, and it's been getting a lot of people sick, the 3 of these combined, and it's overwhelming emergency rooms and causing even a cold medicine shortage. So there's a shortage of like Tylenol and kids Motrin and things like that. So it's been quite impactful, and it's important that we know the steps, again, that we can take to protect ourselves during this holiday season, and keep ourselves healthy as much as possible for our sake, our friends and family sake, but also the sake of our healthcare systems and making sure that we're doing our best to stay healthy. So while we know that vaccines and early treatment are the best defense to COVID-19 infection and serious outcomes, including hospitalization and death, there are other tools that are very important to utilize as we can see an uptick in cases, hospitalization, severe illness, and along with the uptick in flu and RSV. These tools that I'm going to share, and this model is a great tool to represent everything that we can do to minimize our exposure to COVID. But I mean, some of these things can obviously impact our susceptibility to flu. Well, not our susceptibility, our risk for flu and RSV. So this model is great because it breaks it down into kind of personal responsibilities, but also shared responsibilities. So the first one is physical distancing and staying home if you're sick. And here I would also add that another first possibility is reporting and getting tested. Those are also our personal responsibilities, because if we're testing and we report if we've gotten sick, that to our close ones or people we may have exposed, our coworkers if we're in office, it's important so that the people around us can also take the proper steps if they have been exposed. So I would add that there. Then there's masks, which we'll go over a little bit deeper, because I think it's important for people to understand like how masks came to be and kind of retouch on that again, because masks are effective. So there's masks, then there's hand hygiene, cough etiquette. So of course, wash your hands as often as possible. Use hand sanitizer when you're on the go. But then cough etiquette, just cover your coughs. I think that is something we've all learned, but covering our coughs and our sneezes is really essential to slowing the spread of many illnesses, because those droplets that come from our coughs and our sneezes, whether we can see them, feel them, or not, they can spread the virus. Avoid touching your face. That is important because you don't want to spread the viruses that could be living on our hands to our nose, eyes, nose, and mouth. So that's very important. Next, if crowded, limit your time. I know that we're kind of going back out into the world. We're not as locked down as what we were. But if we're going to be in a crowded space, we may want to limit our time and limit our exposure. Testing and tracing is next, right here. Ventilation, doing more outdoors activities, and air filtration. And this is ensuring shared responsibilities, especially ventilation, air filtration. That might be a responsibility of the businesses we're entering, the employers that we work with. So we want to kind of put that as a shared responsibility, because that might not be something that we can fully control all the time. We put some trust in others to kind of further that one along. Same with government messaging and financial support. That is a shared responsibility. Places like nature, or places like NKFM can advocate for more messaging for financial support and encourage the government to do those things. However, that shared responsibility lies with the government as well to actually do that. Quarantine and isolation. This is a shared responsibility because it works when everyone knows what the recommendations are and then follows up with them. So that is very important. And then vaccines, again, they have a great personal impact. It can prevent severe illness. It can stop you from getting the illness at all. It can give you your best chance of protection. But the shared responsibility and the larger accomplishment of vaccines is, that herd immunity, where it can protect groups of people because the virus isn't able to spread as easily. So it is a shared responsibility as well as a personal responsibility, because that's where the impact really lies, is when everybody or a very large amount of people get the vaccine. So like I said, I wanted to touch on masking. Masks at the start of the pandemic it was confusing to say the least, because initially we were like, no, the CDC and the government was saying, don't buy masks, don't buy masks, don't buy masks. You don't need masks. And then it switched, right? And we were all there when it switched and everybody needed a mask, and people were sewing cloth masks, using medical masks. Then there's the recommendation to have a N95 mask. So it's important to know, if you're hesitant because of that change that occurred a couple of years ago now, that we have to remember that we were all learning on the fly. And so as soon as there was information that masking was effective, that's when the government stepped in and was like, hey, just kidding, we got it wrong. Masks are effective. We also have to realize that our healthcare facilities were very overwhelmed at the time. So there was this sense of urgency to make sure that medical grade masks were reserved for the medical field, but mask production and availability was able to increase and kind of meet that demand that we had. So according to a study that was recently complete, according to most recent studies, masking is effective. So masks should be used as part of a comprehensive strategy. So utilizing everything that we talked about, or as much as what we talked about in the last slide as possible. The mask alone isn't going to prevent a high level, or it's not going to increase your risk or decrease your risk that much by itself. But if you pair it with some of those other strategies that we talked about, you can get adequate protection from COVID-19. And wearing a mask should be a normal part of being around other people. Appropriate use, storage, and cleaning or disposal of masks are essential to them being effective as possible. So by this we mean, it was a part of our everyday life for a while, but now the government is recommending, and a lot of agencies are recommending that we go back to masking in some areas. Like we said, monitor your community levels, monitor your comfortability with what's going on in your community to decide if that's good for you. But in general, masking is a good idea. But you have to utilize them appropriately and effectively in order to get that protection. So if you have an N95 and you're wanting to utilize it, make sure you're storing it properly. Make sure you're tucking it away in your bag properly. Make sure that you're cleaning them. If you have the cloth ones and you're reusing them, you got to clean them. You can hand wash them. Honestly, I threw mine in the laundry. Turned out fine. You just want to make sure that you're doing that. And they're disposable, your single-use mask. Make sure you're using those properly. So in a nutshell, 4 reasons why you should wear a mask when recommended is they reduce viral transmission. Again, if worn and disposed of and cleaned properly, they reduce viral transmission. They prevent pre-symptomatic spread of COVID-19. So that is getting people sick before you know that you're sick because you're not having any symptoms. And you're protecting yourself from getting sick. And again, in general, they're good. It's a good hygiene practice. All right, so now we're going to move into our FAQs. So the first question is, who is now eligible for updated COVID-19 vaccines? So updated COVID-19 vaccines are now available for children 6 months and older. An updated vaccine helps protect against those severe COVID-19 outcomes, severe illness, and that is especially important for our young who previously wasn't able to get this updated vaccine, and everyone else as well. So children as young as 6 months can now get it, even though young children often have a milder illness if they get sick with COVID-19. Some develop more serious outcomes and need treatment in a hospital. And again, it is rare, but some children who had no symptoms or mild symptoms develop symptoms later that can last a long time as a condition known as long COVID or long haul COVID. And the vaccines are proven to prevent against these long COVID situations, serious illness, hospitalizations, and death. And this is true for young children as well. So while, we don't hear about children getting severely sick as we hear with the elderly or the middle-aged population, it is still an outcome that could happen. And vaccination is the best protection, along with all the other tools that we talked about. Can I get a flu vaccine and a COVID-19 vaccine at the same time? Yes, you can get a flu vaccine and COVID-19 vaccine at the same time if you are due for both at the vaccines. It's important that you don't wait. You might be tempted to be like, oh, I'll get my COVID-19 vaccine when I get my flu shot. If you have the opportunity to get one, get one. If you have the opportunity to get both, yeah, you can get both. So don't put it on hold. If you have the opportunity, whether it's at your health department, CVS, Walgreens, make sure you're updated on your flu and COVID-19 vaccines, and you can get them at the same time. Oops. Okay, I guess that was it. Well, thank you for your question. And if you have questions or if you have feedback, as always, please email us at reach@nkfm.org, or you can visit www.nkfm.org, and we'll be glad to hear your questions or feedback. And we will see you next month for the next video of VFF. Have a great holidays.